In this section, we will explain how to use Cardiac ResQ. Once it arrives, open the AED bag containing Cardiac ResQ. There is a set of 6 first aid items in the AED bag. Plastic gloves to prevent infections. Scissors to cut the person's clothing off if it is difficult to remove. Razor to shave off any thick chest hair the person has. Cleansing cotton wipes for sanitizing. Paper towels to wipe away any water on the chest area. Tablet mask to use for the mouth-to-mouth rescue breath. Please use these 6 items as required. Now it is time to use the Cardiac ResQ. There are 3 main steps. 1. Turn on the power. 2. Carefully attach the electrode pads. And 3. If required, press the electric shock button. Slide the green power switch to the right. This will open the cartridge cover and turn on the power. Once the power is on, the elementary school child to adult mode lamp will light up and the voice guidance will start. Please follow the voice guidance for how to use the AED. Peel off the film on the pad cartridges in the direction of the arrow. Take out the electrode pads. Check the illustrations on the electrode pads, which are attached to the front and back of the backing paper, and peel off the pads one at a time. Carefully check the illustrations on the electrode pads and attach them firmly to the person's bare skin as per the illustrations. Once the pads are attached, the pad attach lamp will stop flashing and stay lit up. Once the electrode pads are attached, Cardiac ResQ will automatically start doing an ECG analysis. Follow the voice guidance while the ECG analysis is in process, and do not touch the Cardiac ResQ or the injured person. When the ECG analysis is finished, the voice guidance will announce the result. If the result is that an electric shock is required, you will hear a sound that indicates charging has started. Once fully charged, the electric shock button will start flashing. Press the electric shock button to deliver the electric shock. Once the electric shock has been delivered, immediately start doing chest compressions. A beep will sound at a tempo of 110 times per minute to indicate when to perform chest compressions. Also, every 20 seconds, the voice guidance will announce the time remaining until the next ECG analysis. An ECG analysis will start every 2 minutes after each 2-minute cycle of chest compressions has finished. If the ECG analysis results determine that another shock is necessary, deliver another electric shock. If another shock is not needed, then please start the next cycle of chest compressions and mouth-to-mouth rescue breaths. Please continue doing CPR until an emergency medical worker takes over doing CPR, or until the injured person starts breathing normally again or is responsive to your voice. Please switch to the preschool child mode when using Cardiac ResQ on a preschool child. For school-aged children and older, use the elementary school child to adult mode. When you're not sure if the injured person is a preschool child or a school-aged child and older, please use the elementary school child to adult mode. Once the power is on, press and hold down the preschool child mode button until it lights up to indicate that mode is now on. The voice guidance will also announce that the mode has been switched to preschool child mode. The electrode pads are for use on all injured persons, including both preschool children and elementary school children through adults. Please be careful when attaching the electrode pads, as the positions for attachment for preschool children are different than those for elementary school children through adults. The AED may not work properly or may cause injury to the person it is being used on in any of the following situations. So please be very careful not to use the AED in these situations.